I'm Dr. Judson Brandeis, a board-certified urologist, and I'd like to talk to you today about circumcision. Circumcision is the surgical removal of the foreskin, and it's the oldest surgical procedure in the world. Approximately 1/3 of the world's male population is circumcised. The incidence varies widely between countries. For example, the rate in England is only 6%, the United States is 70%, and Africa tends to be well over 80%. The reason for this is that HIV transmission is lower in men who are circumcised. Certain religions mandate circumcision, including Judaism and Islam. The American Academy of Pediatrics recommends newborn circumcision and says that the preventative and public health benefits outweigh the risks. The most common reason for circumcision later in life includes phimosis, which is where the foreskin gets trapped over the head of the penis, paraphimosis, which is where the foreskin gets trapped behind the head of the penis, inflammation of the glans, and condyloma. Circumcision has been shown to reduce the risk of HIV transmission, urinary tract infections in boys, sexually transmitted infections, and it virtually eliminates the risk of penile cancer. The goal of circumcision is a good cosmetic result with adequate removal of the outer and inner layers of the foreskin. Minimal bleeding and no infection is essential. Exposing the glands sufficiently to prevent phimosis and paraphimosis, which is the trapping of the penis inside the foreskin or trapping the foreskin behind the glands, is a positive surgical outcome. It's also important to maintain penile sensitivity. For this reason, sometimes I leave a little extra skin to cover the corona. I also leave some extra skin so that the scrotal skin will not get pulled up onto the penis during an erection. One of the risks of circumcision is the possible loss of sensitivity. This is controversial and very difficult to measure. Other complications include bleeding, sutures pulling apart during an erection, concealment of the penis under scar tissue, skin bridge, or attachment of the foreskin to the glands, infection, urinary retention, and damage to the urethral meatus. Fortunately, most of these complications are rare. During the healing process, if there's something that concerns you, feel free to send me images of the healing penis or come in right away to be checked. There are different techniques for foreskin removal, including dorsal slit, shields, clamps, and excision. There are multiple techniques for anesthetic, including a penile ring block, dorsal nerve block, lidocaine spray injector, general anesthesia, and spinal anesthesia. I perform circumcision under local anesthesia in my procedure room in my office. You'll be comfortably lying on a medical table. The advantage of being awake is that we can communicate about the procedure before and during the procedure to make sure that you'll be happy with the appearance. In addition, you will not require an IV or any drugs or an anesthesiologist. We have a flat screen TV for you to watch. Many of our patients fall asleep on their own during the procedure. To start with, we'll carefully inject the base of your penis with a tiny needle and numbing medication. When you're fully numb, I'll remove the excess foreskin with a clamp and a scalpel. I'll bring the skin back together with sutures. And at the end of the procedure, I wrap the incision with antibiotic soap gauze, dry gauze, and a compressive wrap. These come off in 2 days. Your follow-up appointment will be in 2 weeks, and you should be fully healed within 1 month. After circumcision, patients may resume their usual sedentary activities, but should not engage in strenuous activity that causes pain or discomfort for at least a week or 2. It's appropriate to take a shower 2 days after the procedure and then reapply a dressing. No swimming or beach trips for 2 weeks. No sexual activity or masturbation permitted for 4 to 6 weeks after a circumcision. You'll occasionally see a few drops of blood for the first 2 weeks, and some men experience pain with erections at night for the first week, but this typically resolves after the first week. If sutures are required, they'll absorb in a week or two and typically will not require removal. We usually see our patients a week or two after their circumcision to check on their progress. So in summary, circumcisions are recommended because they reduce the risk of sexually transmitted diseases, urinary tract infections, and penile cancer. Circumcision is a safe procedure with minimal side effects and risks. The only downside would be potentially a mild loss of sensation. This is Dr. Judson Brandeis, board-certified urologist. My office is at 100 Park Place, Suite 140 in San Ramon, California. To contact us, please email us at appointments@BrandeisMD.com or call 925-255-7867.